Today we're going to do a neuter and then a dental. The importance of doing neuters on patients is to decrease the chances of prostatic cancer. Therefore, this patient is around 2 years old and we want to decrease those chances, so we want to decrease those hormones, those testicle hormones. The other reason why we also neuter patients is to decrease the hormones, the testosterone. For any behavioral issues, if we decrease those hormones, those testosterones, then it helps calm them down. The third reason, and one of the most important in some places, is to decrease overpopulation. There's a lot of animals in the streets, shelters are full of animals, and we want to decrease, overproduction, overpopulation of animals. Therefore, we highly recommend doing neuters in space. When the patient wakes up, first side to where it indicates, I go to the middle, sure if there's spayed or neutered. Very quick, very safe. I like it a lot. So now we're gonna block the testicle. We're gonna go straight into the testicle. We're gonna pull back for any air or blood. There you go. And then we're gonna inject at least half of what we have in here. This will help, reduce the pain when the patient wakes up. It also relaxes the muscles, so when I'm pulling those muscles, the muscles are more relaxed. Lastly, it also makes the testicle a little bit bigger, so it makes the procedure a little bit easier for me. So we're gonna do today a pre-scrotal, meaning this is the scrotum, and we're gonna do a pre-scrotal incision. So we're gonna pull those testicles, we're gonna push them upward, and then we're gonna make our incision here. The other option would be scrotal, so we would cut straight into the scrotum. And then we normally don't do that technique. And then the last technique would be removing the testicles and removing the whole scrotum. So that one is called scrotal ablation. You remove the whole scrotum. That depends on how big the patient is and how old it is. We sometimes recommend removing the scrotum because it won't heal completely, so you will still have a sac. But with some patients, if they're really young and really small, sometimes that whole sac just reduces in size, and sometimes you doesn't even have a sac there after it heals up. There's a couple of layers we have to go through, and then I always say after I cut those layers, I pop it out like a pimple. There we go. So I'm placing sutures on the spermatic cord because the spermatic cord has vessels. So I'm gonna cut out the testicle, but we have to, suture the vessels so that we don't have internal bleeding. I like to place 2 just to be on the safer side. Now I'm going to verify that there's no bleeding, that my sutures are in place before releasing the spermatic cord. There's no bleeding, so now I place it inside the body. Perfect, and then I'm gonna remove the other one. And I use the same incision, pre-scrotal, to remove the second testicle, so I push it upward, and then I make an incision on there's a lot of ligaments and fascia, so I have to cut it open. This suture technique is called modified Miller's. It's 2 knots in one. Therefore, whenever you tie it down, it's not gonna open. So it's a very safe suture. Very quick, very safe. And I like it a lot. Now I'm closing up the incision. I close first the subq. And I have to make sure, because the inguinal, we have 2 inguinal holes. So therefore, when I close this incision, I have to make sure that I'm closing the 2 inguinal holes. Why? Because we don't want a hernia. This type of suturing is very important. So I go to one side, then I go to the middle, and then I go to the other side. And then I'm gonna do the tattoo. If the patient doesn't have a microchip and it escapes, and any shelter finds them and they're not sure if they're spayed or neutered, at least we have like a a tattoo where it indicates, yeah, they're spayed, they're neutered, and that's good. You may say, oh, but it's simple. You check, it doesn't have testicles, it's neutered. Well, you know, yes, but at the same time, there's some patients that their testicles never descend. So their testicles can be internally in the abdomen. And just by checking the scrotum and saying, yeah, it's neutered, it's not 100% that it's actually neutered. It can actually be a patient that their testicles are in the inguinal region or in the abdomen. Therefore, that's why we always do our tattoos. The dog is already neutered and everything is good.